Major causes of maternal death, a global and preventable crisis. Maternal mortality refers to deaths due to complications from pregnancy or childbirth. From 2000 to 2023, the global maternal mortality ratio, MMR, declined by 40%, from 328 deaths to 197 deaths per 100,000 live births, according to UN interagency estimates. This translates into an average annual rate of reduction of 2.2%, while substantive, achieving the Sustainable Development Goal, SDG, of 70 maternal deaths per 100,000 live births by 2030 will require an annual rate of reduction of almost 15% over the next 7 years, 2024 to 2030. Hemorrhage, hypertensive disorders of pregnancy, like preeclampsia, pregnancy-related infections, and complications of unsafe abortion. Additionally, pre-existing medical conditions, aggravated by pregnancy, can also lead to maternal death. Many of these deaths are preventable through access to quality antenatal and postnatal care, skilled birth attendants, and prompt emergency obstetric services. What is maternal death? Maternal death is defined as the death of a woman during pregnancy, or within 42 days of termination of pregnancy, from any cause related to or aggravated by the pregnancy or its management, excluding accidental or incidental causes. Major causes of maternal death, in detail. 1. Postpartum hemorrhage, PPH, the leading direct cause of maternal death worldwide. What happens? Severe bleeding after childbirth, usually within 24 hours. Causes: uterine atony, failure of uterus to contract. Retained placenta, trauma, bleeding disorders. Fatal outcome: rapid blood loss causes hypovolemic shock and organ failure. 2. Hypertensive disorders of pregnancy. Includes preeclampsia, eclampsia, and HELLP syndrome. What happens? High blood pressure leads to seizures, eclampsia. Liver rupture, stroke, and kidney failure. Timing: usually in the third trimester or postpartum period. Risk: poor prenatal screening often delays diagnosis. 3. Sepsis, puerperal infection, a deadly bacterial infection of the uterus and surrounding tissues after delivery. Or abortion. What happens? Bacteria enter through unclean delivery tools or prolonged labor. Symptoms: fever, foul vaginal discharge, abdominal pain. Complication: can lead to septic shock and multi-organ failure. 4. Unsafe abortion, a significant cause in countries with restrictive laws or poor access to reproductive health services. What happens? Incomplete, unhygienic, or self-managed abortion leads to infection, bleeding, or uterine rupture. Prevalence: higher in regions with limited family planning options. 5. Obstructed labor and uterine rupture, occurs when labor is prolonged and the baby cannot pass through the birth canal. What happens? Physical exhaustion, infection, bladder damage, uterine rupture. Delayed action, often fatal if caesarean section is not accessible. 6. Amniotic fluid embolism, a rare but highly fatal allergic-like reaction to fetal fluid entering the mother's bloodstream. What happens? Sudden cardiovascular collapse, seizures, respiratory failure. Challenge: usually unpreventable, needs intensive care. 7. Anemia. While not always a direct cause, severe anemia contributes significantly to fatal outcomes during hemorrhage and infection. Indirect causes: pre-existing medical conditions like heart disease, diabetes, or HIV/AIDS can be aggravated by pregnancy and contribute to maternal mortality. Factors influencing maternal mortality: access to quality health care, lack of access to antenatal care, skilled birth attendants, and emergency obstetric services, significantly increases the risk of maternal death. Social and economic factors: poverty, lack of education, and inadequate transportation can delay or prevent women from accessing necessary health care. Delayed or inadequate care, delays in seeking care, delays in receiving appropriate treatment, or inadequate management of complications can lead to fatal outcomes. Unsafe abortion. Lack of access to safe and legal abortion services drives women to seek unsafe procedures, resulting in high mortality rates. Prevalence. Globally, Over 800 women die every day. Due to maternal causes, 1 every 2 minutes. The vast majority of these deaths occur in sub-Saharan Africa and South Asia. The leading causes vary by region, but postpartum hemorrhage and eclampsia remain top contributors in most low-resource settings. In Nigeria, India, Pakistan, and Bangladesh, maternal mortality remains a major public health burden due to limited access to skilled care and emergency services. Risk factors for maternal death: teenage pregnancies and mothers over age 35, previous caesarean section or complicated births, multiple pregnancies, twins, triplets, short birth intervals, less than 2 years, poor access to antenatal and delivery care, low maternal education and income, malnutrition and chronic illnesses, e.g., HIV, diabetes, hypertension, cultural or geographic barriers to timely care, prevention and control strategies, antenatal level, early registration and regular checkups, blood pressure monitoring, urine testing, blood grouping, iron and folic acid supplementation, birth preparedness counseling, management of high-risk pregnancies, intrapartum level, skilled birth attendants, clean and safe delivery practices, use of uterotonics, like oxytocin, to prevent PPH, emergency caesarean section availability, timely referral of complicated cases, postpartum level, monitoring of bleeding and vital signs for 24 to 72 hours, early detection of infection or hypertension, family planning counseling and contraception provision, preventing maternal mortality, antenatal care, regular checkups during pregnancy, allow for early detection and management of potential complications, skilled birth attendants, having trained doctors, nurses, or midwives present during childbirth, can ensure prompt and effective management of complications, emergency obstetric care, access to facilities equipped to handle obstetric emergencies is crucial for saving lives, family planning, empowering women to make informed choices about family. Size and spacing can reduce the overall number of pregnancies and improve maternal health outcomes, addressing social and economic barriers, improving access to education, healthcare, and economic opportunities for women, can reduce their vulnerability to maternal mortality, management of major causes, PPH, immediate uterine massage, for fluids, oxytocin, blood transfusion, surgical intervention if needed, eclampsia, magnesium sulfate, antihypertensives, emergency delivery if warranted, sepsis, broad-spectrum 4 antibiotics, fluid resuscitation, surgical drainage if abscess present, unsafe abortion complications, surgical evacuation, antibiotics, psychological support, obstructed labor, timely caesarean delivery, monitoring labor progression using partograph, anemia, iron therapy, deworming, nutritional counseling, blood transfusion in severe cases. Action plan. 1. Community awareness. Educate women and families on danger signs in pregnancy. Promote birth preparedness and family planning. 2. Strengthen health systems. Ensure 24/7 access to emergency obstetric care. Improve transport systems and referral linkages between facilities. 3. Train health workers. Continuous training in basic and comprehensive emergency obstetric and newborn care, BMONC. Training in respectful maternity care to reduce delay due to neglect. 4. Ensure essential supplies. Stock and distribute uterotonics, magnesium sulfate, antibiotics, for fluids, and blood products. Provide delivery kits and personal protective equipment, PPE, for clean practices. 5. Implement maternal death reviews. Investigate every maternal death. Identify gaps and respond with local interventions and accountability mechanisms. 6. Policy and financing. Support free maternal healthcare and delivery services. Expand health insurance to cover emergency care. Summary. Maternal deaths result primarily from hemorrhage, high blood pressure complications, infection, unsafe abortion, and obstructed labor, conditions that are almost entirely preventable or manageable with timely intervention. The risk is highest among women with limited access to skilled care, nutritional deficiencies, and low education or income. Conclusion: maternal death is not just a medical issue, it is a reflection of the value a society places on its women. Reducing maternal mortality requires a comprehensive and multi-sectoral approach, one that integrates clinical care, community engagement, education, and political will. Every maternal death should trigger not only sorrow but systemic change.
If you find this video helpful, like, subscribe or follow My Health by Dr. J for more important health videos.